Kia ora koutou and welcome to eHealthTALK NZ. I'm Rebecca Macbeth, I'm Media Editor at HINS, and today I'm joined by Chief Medical Officer at CareHQ and Clinical Director for Health Equity at ProCare, Dr. Reza Jarral. So thanks for joining us. Can you start by telling us about yourself and your recent successful application to be a Harkness Fellow, which is very exciting?
Kia ora, Rebecca. Thank you so much for having me. Absolute pleasure to be here and to share my story. So I'm a primary care doctor working as a GP. I trained in London and came to New Zealand 10 years ago. My practice is predominantly with high needs communities, so with Māori and Pacific patients, quintile 4 and 5. And over the past 5 years, I've gone on a journey from the front lines of healthcare, looking at through the lens of health technology and clinical leadership to try and understand how I can advocate for my patients and deliver better outcomes, particularly in the context of the challenges we're facing. So that journey took me to Tech Futures Lab, where I did a master's in artificial intelligence in health in 2019, and to my two leadership roles, which you mentioned, which is as Chief Medical Officer of CareHQ, a national telemedical service, and the Clinical Director for Health Equity at ProCare. I currently work with Bridgewest Ventures, which we're partnering with Callaghan Innovation to support the incubation and commercialisation of deep health technology in New Zealand. And more recently, I've been selected by the Commonwealth Fund, the Ministry of Health, and Te Whatu Ora to be New Zealand's Harkness Fellow for 2025 to 2026, which is an incredible opportunity, and I'm so grateful. It will give me a chance to go to the US to perform comparative research and to bring back some really interesting findings and connections and learning to New Zealand to benefit our population here.
Great. Well, you certainly seem to be keeping very busy. So when do you actually go to the US and what exactly will you be doing?
So I'll be going to the US in August. My plans are still being formed, so they're subject to change, but I will be based out of Stanford and working with mentors in the Bay Area to try and understand how we can measure and scale effective health implementations, particularly digital health, looking also at the behavioral science behind digital health. And I'll be working also in New York to understand how we can work across agencies, across disciplines, to get better and more effective implementations in our health system. It's a bit early to say exactly where I will be working with, but we're looking at large healthcare and academic units, large payer providers, NGOs, think tanks, really thinking multilaterally on tackling the challenges that we face in healthcare. So I'll have more information to share on exactly who I'll be working with soon. It's very much a case of forming the plan and then leaving this August to see where I land.
An adventure. So what digital health technologies are you most interested in exploring while you are over there?
I think my initial proposal for the Harkness Fellowship application process focused very much on wearables, health apps, digital coaches. There's some really exciting case studies and also some meta-analyses which demonstrate some potential for these. But what I've been challenged more recently is taking a step back from specific technologies and thinking at the policy level, referencing the government policy statement on health and thinking from a payer provider perspective, what are the policies that we need to implement to support effective digital health implementations in New Zealand in the prevention space? So while I will be doing some deep dives on specific technologies, I think the challenge for me in the Harkness and also for me as a clinician is to take a step back and look at the federal level to try and understand how we are regulating and encouraging the adoption of technologies like generative AI, agentic AI, FDA-approved consumer devices like smartwatches and earbuds that people are using for diagnostic purposes as well as well-being, and then apps and services that consumers and payer providers might be using like Noom and Verily, or international examples like Holly Health and Humour, where we're merging that behavioural science with digital health.
Mm. What does that mean exactly? You're talking about behavioural science and digital tools, how they can improve health outcomes. What is your view on how they sort of intersect with each other?
Well, I think the first thing to point out is that digital health solutions very much are an adjunct to existing grassroots foundational healthcare systems, not a replacement. So they're very much there to support rather than replace, but they do offer amazing potential to reach populations at scale. Um, and I feel that we have a moral imperative in healthcare to use some of these emerging technologies to their best potential. Because if you look at platforms like YouTube, Amazon, or Netflix, we can see that digital services are being curated and delivered in a way to optimize certain outcomes, whether it be clicks or stickiness or funneling users down a consumer chain of activities. But in healthcare, we're not really using that type of behavioral nuance to encourage healthy behaviors and optimal outcomes. So if we can provide health consumers, patients, whānau, with timely, relevant, useful nudges and sticky platforms that keep them engaged, we might be able to improve healthcare compliance with treatment plans. We might be able to encourage people to exercise more, to sleep better, to engage with their mental health, to make better choices with their diet. And this focus on the prevention space is really in reflection of the enormous burden that non-communicable diseases are placing on our health systems globally, as well as in New Zealand, including chronic diseases like cardiovascular disease, diabetes, and metabolic syndrome. So it's really this convergence of looking at what the new technologies can provide in terms of giving us timely, relevant, and impactful nudges to our behavior, but looking at the burden of healthcare and the challenges that we will need to tackle if we're going to deliver a sustainable, safe, and also equitable health system for future generations.
So, are there some particular digital interventions that have shown a lot of promise internationally in changing health behaviours that you're interested in looking at? And I know there's been some quite successful trials in New Zealand of quite simple things, just like text message reminders, but I'm sure it goes up to a high level now in terms of what's possible in terms of a digital intervention.
Yeah, absolutely. And I should very much give reference to Professor Robin Whitaker, who's a previous Harkness Fellow, whose shoulders I very much stand on in terms of understanding the landscape of behavioral change. Robin was at the forefront of this many years ago, and she still continues to lead the charge on effective digital behavioral change technologies. Some of her work did look at mobile health interventions for text messaging, I believe for population health screening activities and engagement with smoking cessation services. What we're seeing in the evidence landscape is that there are large comprehensive umbrella reviews which demonstrate really great changes in terms of behavioural for non-communicable disease prevention. A couple of years ago, there was a study that looked at 85 different reviews covering close to 1 million patients, and they found that there were very much effective changes in terms of goal setting, cues, prompts, all delivered through a digital medium that helped patients navigate chronic diseases. But we're not seeing that take off at a population level. There are some exciting interventions. For example, Verily, Google Life Sciences have a chronic care management platform for diabetes, which provides personalized interventions, timely data and insights for users that help them manage their diet with continuous glucose monitors, for example. And they're integrating an AI coach with smart goals for that. So there are some pockets of excellence. There's emerging evidence. There's also a great deal of skepticism. So what we need to understand is where are we failing, or where should we avoid spending money for things which are exciting and have hype around them, but aren't delivering change on the front lines that we need to. So it's very much exploring that space and finding out what is working, what isn't working, and what could we apply in our New Zealand context.
You're obviously working day to day as a GP as well. What's your impression of the appetite amongst consumers to take these things on?
We are seeing a global trend towards convenient, timely digital services, not just in the health sector, but across all sectors. Patients, whānau, consumers want enablement. They want to access platforms that enable them to navigate complex health systems, coordinate engagement with healthcare providers in a way that's convenient and timely for them. With that said, I've been speaking about moral imperative. I feel that we have a real moral imperative to ensure that as the world goes through enormous digital transformation across our society, we do not leave people behind. And that digital divide is something that I'll be closely evaluating in the US. I've already reached out to collaborators working on the digital and broader social determinants of health to understand how we can tackle that digital divide, enable populations to use digital tools, and for those who don't want to use it or who are unable to, they're not left behind. They're supported and cared for in a meaningful way that's reflective of our obligations to the Treaty of Waitangi.
You also lecture on the responsible use of AI, amongst the other things that you do. So can you just talk a bit about what that involves and how transformative you do believe AI will be? You were mentioning there separating the hype from the reality.
Yeah, I think AI is now very much in the front of debate in society, not just with technologists, but the general consumers are aware that AI is a hype, it's a buzzword. It has enormous potential to ease bottlenecks, to enable more personalized, compassionate, effective care, to optimize a heavily resource constrained health system for better outcomes. With that said, over the past 50, 60, 70 years, artificial intelligence as a field of study, which is not homogeneous, very varied in its applied science, has gone through cycles of excitement and disillusionment, what we call hype cycles. We do feel that we are possibly at the top of a hype cycle with AI, but we can really see some maturation of some really effective implementations coming to the front line. So I don't think that we're going to go into another AI winter where excitement completely stops. I think we'll see an AI autumn where we start to see these applications mature and scale. There are some limiting factors to that. One is responsibility, privacy, tackling bias, and regulation as well. And a big part of that is trust. I think that we have an obligation to work across public and private to enable trust and create frameworks that allow these technologies to scale and deliver the impact that we need them to deliver, but not to cause undue harm. A lot of my research with Tech Futures Lab and my lecturing work was looking at those areas where AI infringes on human well-being over the past 5-10 years, and what are some of the tools and solutions we can apply to minimize potential harm and mitigate from bias in the future application of AI.
Mm. So is that the work with Callaghan Innovation that you mentioned at the start, or is that a separate project?
That was my master's degree at Tech Futures Lab in Auckland. So that was my first pivot from front lines of healthcare into tech, and I did I think a 15 to 18-month master's degree with Tech Futures Lab, and I focused on the ethical application of artificial intelligence in health. I also, at that time, worked with the Rockefeller Foundation in New York to incubate an idea where we were hoping to predict outbreaks of infectious diseases in refugee populations using machine learning. Of course, COVID hit at the same time, so that there was a lot of excitement and energy around the idea. And that was a really exciting period of my life from 2019 to 2020, where I dived into this world of technology, fresh out of primary care. And from that year, I very much went into a clinical leadership position because I realized that entrepreneurship is wonderful, but unless you're part of the system, you can't enact change. So that's what I've been doing for the past few years, working with ProCare and CareHQ in order to understand what levers we can pull at the regional level to get better outcomes with technology.
Yeah, so as Clinical Director for Health Equity at ProCare, can you tell us about any equity considerations that are central to your work there?
Equity, I think, is at the forefront of everything we do at ProCare. So it's not just a box to tick or a department, it's very much across all initiatives. So I've been fortunate to work all the way from the clinical directorate, supporting our practices with their services across population health initiatives and collaborating at the national and international level on data shares that tackle health equity and gaps in where we're seeing poorer outcomes for some groups in our society. Just to give you a couple of examples, we've looked at wide-scale data shares globally as part of the Global Vaccine Data Network to understand safety signals around immunization, particularly the COVID immunizations. We've also worked with IMAC and the University of Auckland to localize tools developed with the World Health Organization in New Zealand to understand the barriers for vaccination uptake for our Māori and Pacific tamariki. And we've worked more locally to collaborate with Māori healthcare providers to provide them with precise population health data that allows them to target population health initiatives on a door-to-door basis, so that we're supporting our highest needs whānau with personalised local interventions with people who they know and are familiar with. So huge breadth of work, really fortunate to work with an incredible team who are on the same page when it comes to prioritising health equity, because we know that if we lift up our highest needs groups, at a population level, we'll see better outcomes for everyone.
So how do you plan to translate what you learn in the US back into your work here in New Zealand?
So we'll have to see where the projects go, but broadly speaking, I think there's practice doing stuff, and then there's policy advising how we form policy. At a practice level, I can see projects emerging, obviously with ProCare, with the largest primary healthcare network in New Zealand, working with our network of primary care providers, sharing knowledge across best practice and uptake for new technologies. I'd love to see work with Janine Bycroft at Healthify, which is New Zealand's largest health information sharing platform, accessed by, I believe, 1.6 million New Zealanders every month. So we could look at how health information is being delivered there. And of course, my other networks, including Callaghan Innovation, Bridgewest Ventures, Southern Cross, and CareHQ. There's so many ways that we can apply new technologies at the practice level. Stepping up to the sort of higher level policy audience, I'm really excited to work with Te Whatu Ora, the Ministry of Health, the Royal Colleges, to look at how we can disseminate not new knowledge that I gain in the US at the policy level in terms of guidance, documentation, best practice, developing strategies to implement digital health in New Zealand. And then stepping one level higher at the international level, what role does New Zealand play across Asia Pacific to be an ambassador for safe, equitable, fair digital health solutions? What connections can we build across this region so that we're very much part of that narrative and we ensure that no one is left behind in this digital future?
Great. Well, I'm sure that at HINS and everyone listening very much supports you in that goal, and we'll be very interested to hear how you get on and connect again once you're back perhaps and hear more about it. So thank you so much for your time today, and hopefully we'll hear from you soon.
Thank you so much, Rebecca. Let's keep in touch.
Mā te wā.